Our resident veterinarian, Dr. Craig Pryor, is here now to answer your questions, and I feel like I'm underdressed right now.
Merry Christmas to you.
Merry Christmas to you. You doing all right?
Very well, thank you.
Hey, Moo, what's up? Hey there. All right, got a host of folks on the line right now. Kim, thank you for watching. Go ahead, please.
Yes, I have 2 cats that I adopted from the Metro Animal Shelter, and they're 2 years old, and neither one of them, I cannot get them to get along at all. And I have tried the quiet moments from Petco, and I've tried, having them both in their cages and look at each other for an hour, and it's stressing me out.
Right. So you have I can only give you a 30-second answer to about an hour-long conversation. So you need a lot of help. You need to talk to a veterinarian who does a lot of behavior work. I would be using feel-away diffusers, feel-away sprays. They're pheromones that help calm. You need to have cat towels. You need to work out what the dynamics of the house are, what the personalities are like, who's dominant, who's not, and how to help them get along. So this is something that I really can't help over a phone call with you. So I would advise you to talk to your veterinarian. If they don't want to do behavior work, then there is a veterinary behaviorist that comes to town that you can help, and they're at Blue Pearl. So I would pursue that.
All right, fantastic. All right, Glenn, thank you for watching. Go ahead, please.
Hello, I have a 10-year-old rat terrier, and she's diabetic. And for the last month and a half, the vet and I have been trying to get her insulin regulated. He's using the insulin number N, and we're giving her 3 units at night and 2 units in the morning.
Right.
And I just wonder if that would be your insulin of choice for this particular dog.
So the insulin of choice is the one that works. There are a number of different insulins we use in dogs. Vetulin, Humulin N is another one. She sounds like the one you're on. If I have a dog that is having a lot of trouble getting regulated, then I'm going to look to make sure that there's not something else that's helping to prevent that. Sometimes they have infections we're not aware of. A lot of dogs will get urinary tract infections. They're not obvious. They're just there, and they prevent the animal to be able to regulate properly on insulin. Some dogs have Cushing's, another disease, which makes it harder. So if you're having troubles with it, need to sort of make sure there's nothing else going on that's just not visible on a physical exam. So talk to your veterinarian about those type of things as well. But it sounds like you're probably on the right track.
All right, we've got Lene on the line. Lene, thank you for watching, and go ahead, please.
Yes, sir. I have a Seal Point Siamese cat, and she's over between 10 and 11 years old. And here recently I've noticed that she's having a discharge in her private area, and I'm wondering if this is something going on with her that I need to take her to the vet.
Has she been spayed?
At her age, does this happen?
Has she been spayed?
No, sir.
Okay, so yes, you need to take it to your veterinarian because there may be something going on there. They do get a condition called pyometra. There's a number of things that could be going on. So I would encourage you to take you to your regular vet.
All right, and just speaking of spaying, go ahead and just kind of recap some of the specifics there on when you spay and neuter.
So we recommend spaying dogs and cats at 4 to 6 months of age, especially dogs, before they come into heat. You can decrease the incidence of breast cancer in later life in dogs by up to 60%. And most breast cancers in dogs can be malignant. So good health benefits there. Dogs and cats, we like to neuter, again, about 4 to 6 months of age. Some a little older, depending on the breed.
Okay.
But the earlier, the better.
And then what happens if they're not spayed or neutered? So
you can end up with a lot of health problems, reproductive problems in female dogs and cats, and then in male dogs, it helps decrease the incidence of, you think about the male dog, the death rate in intact male dogs is a lot higher because they're out roaming more, they're out chasing girls, they're getting into trouble, things like that. And then there are diseases of both male and female dogs and cats that you can avoid through the neutering process. And we stop unwanted pet population.
Okay.
So that's the other big thing. There's 3 to 4 million dogs and cats put to sleep every year because they don't have homes.
Yeah.
Spay and neuter.
Spay and neuter. Make sure you do that, especially if you get an animal for the holidays. Great information there.
Yes. Thank you. Don't give an animal as a gift unless
you've talked to them.
Yes, absolutely. Otherwise, you're going to end up with that dog or cat in a shelter, and we don't want that.
Yeah, definitely so. And again, we appreciate the festive suit there.
Merry Christmas to everybody.
And Merry Christmas. And if you've got more questions, give Dr. Pryor's expert a call over at the Murphy Road Animal Hospital in Sylvan Park. Back with an update on the rain forecast coming up next.
This segment sponsored by the Nashville Pet Emergency Clinic.